Hello, Mr. Smith. My name is Cheyenne Faunus, and welcome to Carrington Wellness Clinic. I'm so glad we can still communicate virtually during this crazy COVID time. How this virtual conference works is you will see myself and 3 other nurses who will talk to you about your diagnosis of shingles. This is an interactive conference, so if you have any questions, please do not hesitate to ask. As I mentioned before, we're here to talk about your shingles, or also known as herpes zoster. Shingles is a reactivation of the varicella zoster virus, which most people associate that virus with chickenpox. But shingles is slightly different. Usually, after one recovers from chickenpox, the virus remains latent in the dorsal root ganglia of the body. But sometimes this virus can reactivate, causing a painful rash to appear that's called shingles. It is more common the older you get, and it is potentially contagious to anyone who has not had the varicella virus or a vaccine, or if they're immunosuppressed. Typically, some signs and symptoms that someone has shingles is a linear distribution of grouped vesicles and pustules that line the skin that look a lot like chickenpox. Most likely, these show up on one side of the body, usually around the abdominal trunk of the body, the face, or it can be on the lower back as well. There can be a burning sensation, tingling, itching, as well as mild to severe pain during the outbreak. Some people can even develop a headache, light sensitivity, extreme tiredness. When the shingle rash develops, it happens in a cluster of vesicles. These new vesicles start forming over 3 to 5 days, and then slowly start to dry out and crust over. It can take 2 to 4 weeks for the body to heal from the shingles, and there could be some skin discoloration as well. Approximately 1 out of 3 Americans develop shingles in their lifetime, and it usually happens only once, but there are a few people who can develop them chronically. We are unclear why the varicella zoster virus reactivates, but we do know that it typically happens over the age of 50, and it can go up as higher in women than it is in men. We also know that African Americans have a 50% less chance of developing the herpes zoster virus than those who are Caucasian. Up next is going to be my fellow nurse Katie, who's going to be talking about how we test for herpes zoster.
Hi everyone, I'm Nurse Katie. I'm here today to go over the diagnostic methods for shingles virus, also known as herpes zoster. Your doctor will first ask if you've had the chickenpox. The shingles virus is actually a reactivation of the chickenpox, so this is an important part of the assessment. Once the patient has confirmed that they have had the chickenpox, the doctor will take a closer look at your current symptoms. Shingles is usually diagnosed based on a history of pain on one side of your body, along with rash and blisters. The painful rash is the main symptom of shingles, and often your doctor can tell that you have this virus from an assessment of your skin alone. However, if you don't have a rash, or if the rash stretches across the body or looks like it could be some other type of rash, such as herpes simplex or contact dermatitis, your doctor may order lab tests such as a PCR test to confirm a diagnosis of shingles. Your doctor may also take a tissue scraping or a culture of the blisters for examination in the laboratory for confirmation of this virus. In some cases, people have such mild symptoms of shingles that they don't seek medical treatment. However, at the other extreme, severe symptoms may result in a visit to the emergency room. Doctors rarely test for shingles unless the rash alone isn't enough to make a diagnosis. Some people get tested because they're at a higher risk for complications. You might have further testing done if you're about to have an organ transplant, you have a weakened immune system, or you're going to begin a drug therapy that lowers or alters your immune system.
Good morning, Mr. Smith. It looks like you've been diagnosed with shingles. So let's discuss some of your treatment options. There are no cure for shingles, but prompt treatment with prescription antiviral drugs can speed up healing and reduce your risk of complications. There's 2 antiviral drugs that we recommend, acyclovir and valcyclovir. Both of these drugs have similar therapeutic responses. It should decrease the viral replication time and decrease the time of the lesions take to heal. This should also cause an absence of the itching and the painful lesions. Both of these drugs are most effective if you start taking them as soon as possible after the rash appears. So if you think you have shingles, contact your physician as soon as possible to discuss treatment. Shingles can cause severe pain, painful lesions. So your doctor may recommend pain medication, either over the counter or prescription medications. We always want to start with an NSAID, Tylenol, or Motrin, and go from there. If you need prescription medication, there are patches or gabapentin if the nerve pain is really bad. There's numbing agents such as lidocaine that can be delivered via creams or gels or sprays. If it's really bad, we can prescribe narcotics such as codeine. There's also injectable meds, including corticosteroids or local anesthetics. Shingles can also cause some pretty uncomfortable itching. So for the itching, we recommend calamine lotion or a wet compress, or if it's really bad, to take a lukewarm bath mixed with some ground up oatmeal. And all of these things will help relieve itching associated with the shingles. That's all I have for the treatment options right now. I'm going to pass it on to Sarah, who is going to discuss some lifestyle modifications. Thank you.
Hi, Mr. Smith. My name is Sarah. I'm going to be talking about lifestyle changes you can make as well as some tips for general wellness today. So first and foremost, super important, we want to make sure that you're keeping up with your vaccinations for shingles, even though you've already had it. Like previously mentioned, Shingrix is good for at least 4 years after your vaccination. So you'll want to start thinking about getting another one starting July of 2024 if you get one this month. To prevent any reoccurrence of shingles, we want to make sure that you're staying away from anybody who is infected, and especially stay away from the fluid in those vesicles, those blisters, because that's what's holding the active virus, and we really don't want to reactivate the virus in you again. So stay away from anybody sick. We want to make sure that people in your household, like your significant other, are also vaccinated. We want to make sure that you're both protected and immunized. As always, it's a good idea to stay active and maintain a good diet. I know none of us want to do it, but it's super important. So to recap, shingles lays dormant in our nervous system and can reactivate later on in life, affecting the nerve pathways, which is why it shows up in that striped pattern, usually around our abdomen. It manifests as an itchy rash and can be super painful. So risk factors for shingles include increased age, immunosuppressant drugs or treatments like chemotherapy. We can treat shingles with antiviral drugs with acyclovir and valacyclovir, as well as implement pain management treatments that you can do at home, as well as over-the-counter pain medications. Again, it can't be cured, but we can treat the symptoms and decrease the length of that infectious period and during the period with that itchy rash. So yeah, do you have any questions for me, Mr. Smith? No? Okay, cool. Well, I'm glad I got to meet you today. I hope you start to feel better. If you have any questions, please call the clinic. And yeah, I think that's all. Have a good day.